planning station is 15 minutes long, and during that time you will create 2 care plans. You will be given the OBS chart back from assessment, and you will also be given a scenario which you must read during that time, and it will identify the patient's current condition or situation if anything's changed. Sometimes the scenario will ask you to focus on certain ADLs related to the patient, such as breathing, mobility or nutrition. The care plans must relate to the problem the patient came in with, so do not focus on side issues like constipation if they came in with a chest infection. The problems are best picked in relation to signs and symptoms the patient is displaying. So use difficulty in breathing rather than chest infection in the case of the respiratory patient. The problem is a nursing one rather than a medical problem. Making it a specific, measurable problem helps you to write it easily and also helps you to write a focused aim. The aim needs to be related directly to the problem mentioned in the care plan. It gives you the aim the nurse and patient would agree upon and how that would resolve the problem. So the re-evaluation date identifies the time you will next review the whole care plan and must be within the time frame of the scenario given. This is when you will review if the problem is still relevant or whether the interventions are working when anything needs changing. The nursing interventions are the things that you will put in place to achieve the aim. There must be at least 4 nursing interventions. To remind yourself, use the mnemonic and MATRID to create these interventions during the OSCE, and they will fall within the standard of the care plan. It's more fully explained further on in the course. A vital thing in the care plan is to ensure that you document the frequency of monitoring required for the patient now. If the patient has a NEWS of 5, ensure that the care plan says monitor the observations hourly, at least. It can be more frequently if it is required. Be specific throughout the care plan, and if you want 4 hourly OBS, put 4 hourly, not 4 to 6 hourly. Ensure you include at least 2 self-care interventions that include the patient and the family. They should be agreed upon interventions, and this should be reflected in the way you write it. They also must be achievable and directly related to the nursing problem and aim, such as Patrick agreeing to ask for help when he's in pain or wanting to mobilise. Lastly, ensure you sign, print and date the care plan to make sure it is a legal document.